Today I'm going to be demonstrating how to properly leak test your anesthetic machine for a rebreathing system. It is very important that you leak test your machines before you do general anesthesia on a patient, because it will let you know if you're losing any of the inhalant gas, which could be detrimental to your patient under anesthesia, as well as to you and your staff personnel if they're being exposed to waste gas. What we're going to do is we're going to start with the appropriate size circuit for our patient. We'll have the appropriate size bag that we are going to use for our patient, so our reservoir bag. Then what we're going to do is we have our oxygen hooked up to our oxygen outlet. I am going to now put my thumb in the end of the circuit to block any gas from coming out, because we are going to be testing to make sure we can maintain a pressure within our machine. And then I'm going to close the pop-off valve. Note that I'm not on a live patient, so it's okay to close the pop-off valve for the leak test. So I'm going to turn that clockwise until it is fully closed. Now what I will do is I'm going to fill my circuit with oxygen. You can do this one of two ways. You can turn on your oxygen flow meter, or you can push your oxygen flush valve because it is not on a patient. Now I'm just going to let the flow meter fill up this bag. You can see my reservoir bag getting larger. And now I'm going to look at my manometer. And when it gets to 20 on the manometer, I am now going to turn off my oxygen flow meter. So I had my oxygen flow meter on to fill up my reservoir bag to a minimum of 20 centimeters of water. As soon as I see that that red needle is at 20 centimeters of water, I then turn off my oxygen on my oxygen flow meter. From there, I now wait and see for about 15 seconds if the needle will drop. If the needle drops, that means I am not able to maintain pressure within the system and I have a leak. If the needle stays where it is, then that means I do not have a leak and my machine is suitable to use for general anesthesia, which this machine is suitable to use. Now, what I must do is, my thumb is still in the end of my circuit. I will now open my pop-off valve fully, so I do not leave it closed when I go to use it on a patient. My pop-off valve is fully open, and you can see now that my reservoir bag has deflated. It's just oxygen, but I can always squeeze it so the rest of the oxygen in there comes out the scavenge hose. And now I can take my finger out of the circuit and I know that my machine is good to use.